squirting does not mean orgasm. Squirting is a female ejaculate. Our bodies are capable of some pretty amazing things. Welcome to the Sexuality Clinic Podcast, designed to help you deepen emotional and physical connections, prioritize your pleasure, and build stronger, more intimate relationships. Hosted by Canadian clinical sexologist Roxanna Smallwood. That's me. This show offers a shame-free space for candid, science-backed discussions on sexual health, body literacy, anatomy, self-exploration, and relationships, both solo and partnered. Whether you're seeking to better understand your body, explore your desires, or communicate your sexual needs with confidence, each episode provides actionable tips and expert insights that empower you to take control of your sexual expression. Ready to prioritize your pleasure and start building the intimate life you deserve? Tune in now and don't forget to download my free checklist, join the waitlist for my online course, or check out my online adult shop at thesexualityclinic.com. Subscribe today and start your journey toward more confident, connected, and pleasurable relationships. So welcome back to the Sexuality Clinic Podcast, exploring pleasure and relationships. Today, we're diving into the intricate and amazing anatomy and physiology of the genitals. Our understanding of our bodies being unique can pave the way to sexual acceptance. Remember that if you're feeling out of sync with your sexuality or unsure about your anatomy, it's not actually you that's broken. It's the way our society presents a one-dimensional standard around our sex and bodies. Whether you're already on a fulfilling sexual journey or you're struggling to find connection, this episode is a reminder that you are not broken. Sexual health is universal. We all deserve to understand our bodies and know we're already sexually whole and healthy, even if we don't feel that way yet. This episode is for everyone who wants to learn more about their genital anatomy, the physiological functions, and how knowing these details can boost confidence, pleasure, and self-acceptance. Just like our faces, our genitals can really be quite unique in their appearance. And while it is challenging to embrace the different looks based on what we tend to see in the media, let me encourage you to not base your confidence, your acceptance of your body around the looks of others, and especially what we're seeing in the media. A number of people are going for all types of reconstruction surgeries because of the brokenness of our society. There are functions in the pieces that we have, the parts that we have. There are so many different appearances. Genital anatomy varies immensely from person to person. From what I've read, 85% of labia are protruding. Meanwhile, the internet would have you believe that it's near 85% that are kind of innies, if you will. No two are alike. Similar to our faces and our fingerprints, our genitals are unique. Our vulvas look different from one to the next. I'm sure that gynecologists could probably recognize patients based on their vulva presentation because we are all so unique and different. That difference is something to be celebrated, not something for you to feel shame around or uncomfortable or only wanting to have the lights off or maybe not even taking a look. We're made up of the same parts, just organized in different ways. That's how Emily Nagoski puts it in her Come As You Are book. So genital anatomy varies immensely from person to person. Variety is healthy, natural, and beautiful. We're made of the same parts, just arranged differently. The differences are not flaws, they're unique characteristics that make each of us extraordinary. This episode is for anyone who wants a deeper understanding of their body, as well as for those who feel pressured by unrealistic standards or worry that their bodies aren't normal or don't measure up. So here you'll find acceptance and knowledge to support your sexual well-being. I'll also share some practical exercises, including some mantras and mirror work to foster some body acceptance and appreciation. Our bodies are beautifully diverse. No two clitorises, penises, labia, or scrotums are identical. These variations are natural and have nothing to do with function or health. They are just different forms of healthy anatomy. Let's just talk briefly about genetics first. I'm talking about male and female bodied individuals and how they come to be. Now, I do understand that there are other variations, such as intersex, where you may actually be born with more than one anatomical structure of a penis or sort of vagina or clitoris type thing. That's for a more specialized episode. This is more general. When we're talking about the clitoris and the penis, we're all starting with the same embryological parts. At about 6 weeks after conception, there's a hormone wash that gets sent through that little growing, developing fetus. And whether or not you have an XX chromosome set or an XY chromosome set, the instructions will be given to your body to either create a clitoris for the XX chromosome set or a penis for the XY chromosome set. If you've got the clitoris, the instructions will be sent to the same tissue to create little vestibular bulbs that will go on either side of the vaginal opening and sort of surround the urethral tube and will be internal in the body. Whereas if you have the XY chromosome set, those instructions will go to that same tissue to create a set of testicles. And so what you can see is, for example, with a pair of testicles, there's a seam that runs between them. Now that seam would actually be an opening in a female-bodied individual. So our bodies are amazing, absolutely amazing. The fact that our hormones and our DNA and our genetics makes up who we are, and there are very specific sets of instructions which are unique to ourselves. The general structures, for example, a clitoris, which maybe we should take a step back here. Often people believe the clitoris to be a tiny little button above the vaginal opening, closer to your belly button than the urethral opening. So for female-bodied individuals, there are actually 3 holes, right? We've got the urethral opening, which is a tiny little hole anterior to the vaginal opening, which is a larger hole, the birth canal, and the anus. Whereas in men, we have the urethral opening, which also has, that's where semen exits, but also urine, and the anus. So male-bodied individuals have 2 holes, and female-bodied individuals have 3. So back to the clitoris. Those bulbs that live inside of the body of a female-bodied individual are actually quite nice to have a little bit of stimulation, just like a little bit of playing with the testicles might be nice. However, a lot of the focus for the pleasure and for the sensation is usually around the glands. That's where we've got the most jam-packed nerve endings. When it comes to our anatomy, they are quite similar in the fact that the female clitoris becomes engorged with blood as it is aroused, and it becomes erect. We're typically thinking about penises becoming erect, right? So penises do become erect. They're both developed with erectile tissue. So the erectile tissue of a clitoris actually makes the clitoris and the glans area become more erect. It fills with blood. It gets you feeling excited and in the mood, typically when you're sort of getting a bit of stimulation on the clitoris. And similar with the penis, of course. So you will notice the similarities with both body parts becoming erect. Another piece of information that's important to know is that both actually get wet. There tends to be so much focus on women needing to be wet and men needing to be hard. Now, the penis sometimes can get hard in just a few seconds. Usually when it comes to physical arousal, the penis will be like, 20 seconds and you're good. Whereas the clitoris, you want to let it warm up and become aroused over a period of about 20 minutes if you've got the time. That's going to give you the best experience, most likely. and you're going to be feeling more aroused. There's vaginal tinting that happens, and the whole response is a little bit different for a female-bodied individual. So while the parts are similar, there are differences to note. Now, when it comes to the clitoris, they're not huge, right? It is a larger structure that's internal than what you can see on the outside. Now, if you're going to grab a little hand mirror and take a look, you may have to lift the hood a little to see the glands. Everyone's hood size is a bit different. Along with the clitoris, there are the labia. There seems to be a lot of stress put on women about the appearance of their labia, especially after childbirth. Our presentation of our labia can change, but I want you to know that if you have protruding labia, that is normal. It is common. It is also normal to have labia that are not protruding. 85% of female-bodied individuals have protruding inner labia, okay? So those labia minora may protrude up to 2.5 inches, okay? There's a variety of size. There may be no protrusion all the way through to 2.5 inches. If I can only reach one person with this podcast and encourage them to grab a hand mirror, turn on a light, and take a peek at what's happening with their genitals, then I will be a happy podcaster. If you haven't yet taken a peek, please let me invite you to explore your own anatomy. If you're not comfortable looking at your own, maybe you've got a partner that you could ask them to take a look, or maybe you do both. There are also other ways to see different anatomies. There are some beautiful projects out on the internet of either casting of vulvas, or there are photograph libraries that you can find. Something that I do find, though, is that many of the presentations are cis white females who maybe have quite trimmed labia, or maybe trimmed isn't the right word. I mean, sort of tucked or smaller in the labia minora. So the clitoris and the penis share homologous tissues, meaning that they originate from the same embryonic structure. So it results in similar functions of sensitivity and arousal. So the penis actually has 4 functions: sensation, penetration, ejaculation, and urination. Whereas the clitoris is only designed to really have one, as far as we have confirmed, which is sensation. Now, my personal belief is that the clitoris actually plays a bit more of a role, or it can play more of a role in pregnancy and childbirth as well, because when it comes to pregnancy, the sperm need to get to the right location. The rhythmic pulsing of an orgasm, which is generally experienced through stimulation of the clitoris, that can help to aid in the pregnancy side of things, getting that semen to the right location, which is deep down that vaginal canal, in through the cervix and up into the fallopian tubes. So having pleasure during intercourse, and in fact after. So sometimes people enjoy to have intercourse for closeness with their partner. Maybe they'll orgasm, maybe they won't. Often external stimulation is required for orgasm for female-bodied individuals. It is okay to have intercourse without an orgasm, and then possibly include your partner in some play, maybe with a toy, if that's what you enjoy, after intercourse. Now, if you're looking to become pregnant, I certainly believe that this could be helpful to have an orgasm after receiving semen. If you're looking to conceive, those rhythmic pulsations of a female orgasm cannot hurt. I mean, the research is sort of back and forth on this, on whether it's helpful or not, but certainly feeling that extra boost of pleasure, getting your body more primed for accepting the semen into the right areas. We want to get the semen all the way up into the uterus, right? So that it can make its journey perhaps up into the fallopian tubes and meet with an egg, so that it can then start doubling and implant into the uterine wall. Getting the semen up into the right spot is the first step. So perhaps after intercourse, whether or not you experienced orgasm during intercourse, might be wise if you're trying to conceive to have a little bit of play, perhaps with a toy or fingers, include your partner, maybe don't include your partner, totally up to you, to experience orgasm after receiving semen in the vagina, because that semen will only be aided by the rhythmic contractions of an orgasm. When it comes to childbirth, though, the anatomy and the physiology is such that passing anything through an unlubricated area can be difficult. If you're feeling like your body needs a little bit of extra lubrication, you're capable of creating that lubrication on your own, and you can experience pleasurable childbirth. So, including your sensuality and your sexuality in your childbirth may be something that you'd like to consider. Perhaps you might like to have a little bit of intimate time with your partner while you're preparing for childbirth. The Skene's glands, which are homologous to the prostate gland in the male bodied individuals, the Skene's glands excrete fluid, which provide lubrication for the vagina. There are other areas where some lubrication can come from. It's not perfectly documented or studied at this point. The female body has not been the priority of scientific study. In fact, the female body has not received much priority. Women are obviously crucial for reproduction, but the pleasure side of our experience has not been explored as much as it could be. So here I am sharing what information I have learned along the way and some ideas to consider. So both male and female bodies self-lubricate. The Cowper's gland in males produce pre-ejaculate. The Cowper's gland is just below the prostate, while in females, the vaginal lubrication actually does originate from several glands. So we have the Skene's glands, which, to be honest, it's amazing to me that we don't already quite understand the female body in terms of whether we have a female prostate or not. The male prostate is something that we know quite a lot of information about. So there just needs to be more research done. Talking about women squirting, for example, it is known that the fluid that comes from female bodies squirting is not urine. However, it passes through the same tube where urine is. And so there may be trace amounts of urine, there usually is. If you're looking to try and experience squirting, which seems to be quite a popular topic these days, there's actually a bit of a horizontal striation in the vaginal canal just below the urethra. So you can see this with a little hand mirror. You could take a peek down there and sort of open the labia and bear down. Now, you may see this tissue where it's a bit more horizontal lines. If you can do like a windshield washer type movement on that tissue with a bit of pressure, you just may experience some squirting. Now, squirting does not mean orgasm. Squirting is a female ejaculate. So our bodies are capable of some pretty amazing things. The squirting thing seems to have been popularized in the last few years. It used to be a concern that women would come to sex educators or clinical sexologists with, saying, "Oh, am I normal? Why am I making this big wet mess?" Well, guess what? There are such things as waterproof blankets that can help to keep your space clean and dry. This female ejaculate is possible without orgasm, similar to the fact that males can actually have ejaculation without orgasm as well. Now, this is a lesser known fact. There's a little film documentary style called Maxwell Multiple Orgasm. This is pretty amazing stuff where it basically talks about edging for men and how you can use your own skill in terms of not necessarily orgasming, but having multiple ejaculates. There seems to be a focus on male hardness and a focus on female wetness. Now, this is for that almighty PVI, penis and vagina intercourse, which of course I'm saying that with a bit of sarcasm in my voice. Sex is so much more than penetration. In fact, most women are not experiencing orgasm from penetration alone. There often needs to be some external stimulation on that clitoris. If you're looking to experience more pleasure from your intimate encounters, I encourage you to explore your anatomy. I'm curious if you've seen all the parts up close, taken a look at the hood over the clitoris, or the glands of the penis head, or maybe that little seam between the testicles, or noticed how the labia are actually quite similar to the testicle in texture. We are actually made of the same parts. It's just a hormone wash early in our embryonic development that either turns us into a male bodied individual or a female bodied individual. Let's dive into the clitoral anatomy. Now, many folks believe the clitoris to be a tiny fleshy button at the top of the vaginal opening. However, while that's not incorrect, there is a lot more to the clitoris. So, what we've got is a little glans, which is that little button that I was referring to, which is often found just a little under a hood. Now, our hoods can vary in size. The the whole shape of the clitoris can vary in size. You may have just a teeny tiny little glans. It may be a lot larger, may look like almost a tiny little micro penis. Now, the glans itself, if you were to be given that hormone wash and you had the Y chromosome in your genetic makeup, then that clitoris head would actually become the head of a penis. So they're both called a glans, and the clitoris becomes erect. It is made of erectile tissue. There are a number of parts to it. I'm not going to go into the very specific, detailed anatomical names, but just wanted to give you a sense of the fact that the clitoris is actually a lot more than just that little button above the vaginal opening. So it actually has a little bit of a curve behind it, and then it comes down and it surrounds the vaginal opening with two bulbs which also surround the urethra. So the urethra is a little hole where you pee out of. And in fact, when you're heavily aroused, it can be more difficult to urinate because the clitoris it swells when it's aroused and it does surround the urethra. So that swelling can make it difficult to pee when you're feeling super aroused. This is also true for males. The clitoris has two bulbs, which you can actually feel. So if you grab a little bit of a water-based lubricant, grab a mirror, have some fun exploring your genitalia. You can sort of grab the entire vulva area, sort of feeling for these bulbs on each side of the opening. The little legs here are actually attached to the pubic bone. So the whole structure itself, while not huge, packs a huge punch in terms of pleasure. So in the clitoris, it's known to have at least 10,000 nerve endings, which is quite amazing for sensation. But as you can imagine, that can be a little much, especially if you're feeling aroused. It can actually almost hurt in some individuals to have direct sensation on the glands or on the clitoris itself. So playing in the area can be advised, but just know that regardless of the size or the shape, same goes for the labia. About 85% of vulva owners have protruding labia, while adult media tends to depict tucked away or slightly trimmed even through surgical procedures, labia as normal. That's not the most common presentation of labia. They often have more of a protruding appearance and have a variety of color to them as well. There are some amazing projects that you might find on the internet where you can see different images of vulva or castings done of vulva. You can even see actual vulvas in fleshlight toys, for example. But please know that vulvas are sort of like faces, where everyone is unique and normal and beautiful just as they are. So something seems to have been wrong with our society in the fact that we often feel shame or feel that the vulvas are not beautiful, that they're something to hide, or, you turn the lights off, you don't take a closer look. And I'd really like to encourage you to embrace the beauty in your body, especially in your genitals, to not feel shame around the appearance, and to know that while certain body styles or types may be in fad for entertainment purposes or for some sort of standard of beauty, that dare not have an impact on your embracing of your own body's beauty and functionality and the amazingness of who you are and what vessel you occupy. So the clitoris and the penis are homologous. These bulbs here actually would develop into the testicles if they were to be turned into a male bodied individual in the embryonic development. Very interesting to see the differences and to see the similarities. But the clitoris does play quite an important role in pleasure for female bodied individuals. With the right stimulation and the right type of movement or body rocking or state of mind, really, to be honest, you can experience quite a lot of pleasure around the clitoris. Self care is crucial, and our bodies aren't weird or gross for their functions. Understanding, caring for, and accepting our bodies as they are helps us to build healthy self esteem and positive sexuality. So if you haven't yet taken a peek at your genitals, please do so, but perhaps with a little bit of a mantra in mind that you might repeat while you are examining yourself or taking a look. Maybe something along the lines of, my body is beautiful and unique. I deserve pleasure. Something that may connect you with your desire to experience pleasure and provide you with the permission. We're made of the same parts, but they're arranged differently. These differences are not flaws, they are unique characteristics that make each of us extraordinary. So, getting to know what your appearance is can be helpful for your own sexual self confidence, to understand the different possibilities for you. Now, remember, orgasm is learned and masturbation is the teacher. So, by all means, grab yourself a little bit of a lubricant and have fun exploring what you like, what you don't like. Make sure that you get to know yourself through your own personal play, but also a couple of suggestions for some self acceptance and body appreciation include mantras. You could stand in front of a mirror, you could sit down in front of a little hand mirror, set yourself up in whichever way makes you feel comfortable. This is a unique journey that you are on in terms of your own sexuality and self acceptance. And you could start by saying something simple like, I am whole, healthy, and complete as I am. Or perhaps, my body is my own, and I celebrate its unique beauty and amazing functionality. Maybe you would say, there is no one size fits all for sexual anatomy. I honor my body's unique design. Or you can come up with one all on your own, but something that is empowering to get you feeling good about the body that you occupy, this vessel that takes us through this very short blip of an existence on Earth. Life is too short to be busying ourselves with the day to day monotonous tasks and not taking the time to really appreciate the vessel that you've been gifted. Life will pass you by. And if you're not taking advantage of this sexual energy that you are, that you have the capability of expanding upon and enjoying and embracing your pleasure, then you're missing out. I really must say, there's something to be said for spending our time really focusing on our careers or focusing on the busyness that we occupy ourselves with. Taking a step back, I like to think of a flower. I usually use the rose in my business. The rose must be trimmed back to bloom again. And so to really step back and think about what it is that you value in your life and to put some priority on that, even if it means taking time away from another area. If you value family or if you value a strong relationship with a partner, then you've got to set the time aside to commit to your partner or to your family or to yourself and your own acceptance of yourself so that as you pass through this very short life, you will feel that satisfaction and comfort and pleasure that you deserve. Pleasure is a birthright. Something else that you could do is some mirror exercises. You could sit or stand comfortably in front of a mirror, taking a few deep breaths to really relax. Observe your reflection. Focus on any insecurities. Appreciate the different parts of your body. As you look, remind yourself that this is a part of your body deserving care and compassion. After observing, you can take a moment to smile at yourself. Look deeply into your own eyes. Perhaps place a hand over your heart. This small act of acknowledgement can be incredibly healing. I've been a little bit all over the place today. The point of this podcast was to talk about the differences and the similarities between the genitals. Okay, so penises versus clitorises. These are made of the same embryologic parts, just developed in a different way based on the hormones and the genetic structure of your unique self. And all are beautiful, all are unique, and all are deserving of sexual pleasure and acceptance. Acceptance by you, the owner, acceptance by your partner or partners. Primarily, it comes down to you, though. Your own sexual self acceptance is really key in your own pleasure and your own sexual journey. So remember, your body is a work of art, and knowledge about your unique anatomy is a key to embracing your full self. So stay curious, stay kind to yourself, and celebrate the beauty of your journey. So if you enjoyed today's episode, don't forget to subscribe and leave a review on Apple Podcast. Your feedback helps us reach more listeners. Thank you for tuning in. Next week, we're going to talk about desire. There are actually two different types of desire. We've got responsive and we've got spontaneous that we're going to deep dive into in our next episode. So thank you so much for tuning in. I look forward to exploring more pleasure and sensuality and sexuality topics in weeks to come. Bye.